Certainly, it hasn't been easy experiencing a pandemic that brought total lockdown in all over the world. But we have to remain strong and follow health protocols in order to ensure safety in our own lives, our various communities, and our future. Stephen Quaye reporting. The global COVID-19 pandemic has affected all of us differently, and Ghanaians in foreign destinations such as Canada are not exceptional. For some, it meant closure of businesses, laid off from work, cancellation of summer plans, not being able to return from foreign trips, struggling with online learning, and engaging with new hobbies. Before the COVID-19 hit, Ghanaians in Toronto live responsible and eventful lives. They work hard to earn wages or salaries to pay their mortgages, buy groceries, and take care of their homes. They were united by their Ghanaian traditional and cultural associations, events such as festivals, customary marriages, meet and dine, barbecues in the park, as well as congregate at various churches. Then COVID-19 hit in March 2020, and the government placed a stay-at-home order on the province that restricted human movement and activities that affected them so much. Some persons whose loved ones were infected with the COVID-19 and passed away argue that once infected with the virus, there was no life for you to live. Those who got infected with the COVID-19 disease and survived also challenged that once infected, there is more life for you to live. But without swelling the argument, the Ontario provincial government took no chances and came out with a lot of restrictions that residents abided by, and at a point, flattened the curve. The companies that offered jobs were closed down and people worked from home. Stores were closed down and businesses done online. Schools were closed down and teaching and learning were done online. Also, public parks and halls were closed down and people could not celebrate their festivals, marriages, and parties, and could not visit their own friends and loved ones. Etobicoke General Hospital is one out of the 40 general hospitals in Greater Toronto Area (GTA) that took care of COVID-19 infected patients at ICU and light unit areas. Frontline workers discharged their duties behind glass panels in order not to infect people with COVID-19 or get infected, same as storekeepers, in order not to spread the deadly virus. When the GTA became a hotspot recently, St. John's ambulance paramedics busily attended to patients in various parts of the city. They rescued lives, prepared patients, and transported them to the hospitals for treatment. COVID-19 testing centers throughout the province busily tested patients for them to know their status. Ontario Bylaw 514 that ordered everyone to wear masks, hanged on doors with hand sanitizers at entry and exit points of buildings. Essential workers that were allowed to go to work were mandated to wear face masks or not allowed on public transport buses to and from work. COVID-19 protocols were strictly observed on the buses, as some ran empty because residents stayed at home. All non-essential stores in shopping malls were closed down or fined not less than 10,000 Canadian dollars for doing non-essential businesses. The food courts in the malls where families gathered and had dinner were closed down. Fast food restaurants and joints in the malls were also closed down to in-dining, but were allowed to sell to the public by pickup only, while cinemas and theaters were also closed down. Sadly, children play stations were closed down and cordoned off as they could not go to entertain and have fun. As businesses were moved to online, teller machines at the banks were idle, where essential stores such as no frills were allowed to open to the public. All busy subways and trains ran almost empty or half empty because people stayed home. Streets of downtown Toronto that never sleeps were silent. Beautiful skyscrapers used as offices were vacant where workers stayed home. The most beautiful Asian St. Lawrence Market in downtown was also closed down. Mainly for students, COVID-19 has been especially difficult as they started a new school year with online classes. As they decide, socialize and reconnect with friends becomes ever present. During summer, people come from all walks of life to picnic in the park, which offered them the opportunity to meet old friends and socialize. These banquet halls, picnic parks, and malls recorded events on a daily basis, and people were often seen patronizing these places.
Since COVID, life has been so hard, standstill, and everything is very hard. You can't even see your own brother or your own family if they don't live with you. I think COVID have come to stay with us. Just as like something like yellow fever, my advice to everyone is to follow the protocol. We have to observe what the health experts are telling us.
The way we were all together, each other, to see each other in the group or in the society, that COVID came and caught things up in between our society, especially our funeral, our parties, our weddings and all this, and we're not able together, or we're not able to come close to each other. Even your own friends, your own family, before you can visit your own family, sometimes you have to give a notice for them to allow you to come. And that wasn't our culture. That wasn't what we were enjoying from the beginning when we were all in Canada. To me, it's not going. It's coming to stay with us. The only thing we have to take care of ourselves, like this nose mask, to be all the time. When we reach in a public place, just put it on. When you have family in the house, you know each other, you can take it off, or you are there by yourself in your room or your house. That's all. But when you are going to the public, my advice is you have to cover your nose, cover everything, so that the protocol has
All that the residents in Toronto are hoping is that this global pandemic goes down drastically and life returns to normal. Reporting, Stephen Armah, Toronto, Canada.